Hey guys.
Hi.
Welcome to our Facebook Live. We're going to be talking about starting hormone therapy.
Yeah.
Oh,
Are we?
what happened?
I think we're still
Are we
on.
live?
Yeah,
Oh, yay,
sorry.
good.
As you can tell, we're not very tech savvy around here. But yeah, we thought we would jump on and just chat about all the different modalities of how you can get hormones. This isn't really a chat about should I be on hormones or not, and we can at the end we'll provide information on how you might go about getting started with hormones. But this is more like there's so many options of delivery methods, and we'll talk about all of them.
Should we start with estrogen?
Let's start with estrogen.
All right. So, one of the major symptoms of perimenopause and menopause are the urogenital symptoms, like vaginal dryness, issues with lubrication, pain with sex, frequent UTIs, pH changes that can lead to frequent yeast infections or bacterial vaginitis. So, even if it's not time to start your systemic estrogen, and if you're having these symptoms, it might be time to start a topical.
Yeah. And so we have a little example of what that might look like. This is one type of vaginal estrogen. Comes in this container, and you essentially you have a syringe, and you put it on the top here. Do we want to actually do it? Okay, yeah. And then you're going to click however many times, whatever the dosing is.
And it fills up the syringe
fills
for
up
you.
the syringe. I'm not sure if you can see this. And I'll show you on this piece of paper. That then the cream comes out. So there you go. That's the topical vaginal estrogen.
And you would initially, for the first couple of weeks, apply it daily, but then after that ramp up, it's just a couple of times a week.
Great.
Yeah.
Next up.
Just to say that this is actually a compounded topical estrogen, but it is also available through a commercial pharmacy.
Correct.
So one of the considerations for that would be if you're going to use your insurance, because I think that would be through a commercial pharmacy versus compounding. You can't use insurance at a compounding pharmacy.
Yep. The nice thing about compounding is you can sometimes add some other things in if you need it, or adjust dosing. Mm-hmm. The other method is the patch. Yeah. These are in high demand right now.
Let's see. So this is the Dottie patch. Yes, and I think it's good news that it's in high demand.
Yes, I think so too.
Not for people who are experiencing the shortage supply, but I think that it's telling me that there's more prescribing happening.
Absolutely.
And that, I think, overall is good news. Can we open it?
Yes.
Okay.
Yep.
They're really, really tiny.
They're tiny.
Now, this is for systemic estrogen, right? So, like, now we're having other symptoms, like hot flashes, for example, or your labs are getting to the point where it's very low, and it's a good idea to start, like, say, to, help preserve your bone density. They're very, very small. And where would you recommend putting it?
So typically people will put it in their lower abdomen area or lower back near their glutes. And it is like a kind of see-through, so you really can't, it's not very noticeable. Usually people will put it underneath their underwear line. Mm-hmm. And you change it out twice a week. We have the ability to adjust the dose based on how your symptoms are once you start using it.
A typical starting dose is going to be the 0.025, 0.05 would be the next. It goes all the way up to 1.0, I think.
Mm-hmm. That's correct.
Yeah. So what do we do if you can't get a patch? If you already you started it, we send the prescription, and the pharmacy says, "Oh my goodness, we are totally out
of patches."
Yeah.
Yeah, so there are a couple of other options out there. Compounded pharmacies again. So these aren't, you couldn't use your insurance for them, but there are topical creams that work well for some people, and again, it just depends on how your body responds. And so we could always try a compounded topical cream. And then there are estrogen pills, and sometimes when people hear estrogen pill, they're like, oh my gosh, no, we're not supposed to use estrogen pills in perimenopause and menopause. The compounded pill that we typically use, it bypasses the first pass metabolism and liver, and so it's totally safe to use that.
Yeah, so any of the dangerous side effects you would hear about oral estrogen does not apply with the BLA tablets,
Right.
compounding pharmacy. hmm I think the other option would be to get pelleted, which is a
Right.
great option, especially for not having to think about something on a daily or even bi-weekly basis.
Yeah, because it's every 3 to 4 months you would get it, and we'll talk more about pelleting when we get to the testosterone conversation. But super easy to put them both in at the same time, and easy to dose it based on either you're starting out, what's the starting dose, or you've been on a patch and you want to convert. Very easy to figure out the dosing.
Mhm. Now, one really important consideration, if you're going to be on systemic estrogen, you have to be on progesterone.
Yeah. So let's talk about
Yeah.
progesterone. Yeah. So one indication for progesterone is you're on estrogen. You got to be on progesterone too. If you haven't started estrogen, a lot of times, some of the first symptoms of perimenopause can be sleep disruption and some mood changes, and sometimes a little bit of progesterone can help with those things. So people sometimes who want to just get a little bit started with hormones will start with progesterone.
hmm Yeah, it's great for that. And it's essential if you're on estrogen, though, because estrogen, when it doesn't have progesterone added to it, can cause your endometrium to build up a little bit more than you would expect at this phase of life, especially after menopause. You really shouldn't be developing much of an endometrium. And that could lead to dysplasia and cancer. So that when you hear about the risk of cancer with HRT, hormone replacement therapy, that's the big one, is that you really have to be on progesterone at least 100 milligrams daily if you're going to be on systemic estrogen. Not the case for topical estrogen, though.
Not the case for topical estrogen. You can do that without any added progesterone.
We were just talking earlier about the quality of sleep that one can get with progesterone. Definitely something to think about. Even if it's not time for you to be on estrogen, it really can make a big difference.
Absolutely. So yeah, different forms of progesterone. There is one company that makes a progesterone cream. It's called Beswickian, and some women notice some change with it. I'd say it's really the people who are really at the edge of just kind of starting perimenopause. So maybe, perimenopause can last 10 years. So maybe it's like right when you're noticing a little bit of period changes, and maybe a little bit of sleep disturbance or mood. And maybe for people who don't want to jump right in with another form, it's a good thing to start with and see how you feel.
How does it, with the recommendation that you're on progesterone with estrogen, is it enough dosing wise?
It's not enough.
Okay.
Yeah, so you can't use the cream then with estrogen. It's got to be with systemic estrogen. It's got to be a different form.
So that's a good place to start. But if you're on estrogen, then you have a couple of options still, though.
Yes.
And you can use your insurance at a commercial pharmacy and get bioidentical progesterone at a commercial pharmacy. But sometimes a compounding pharmacy might be a good idea.
Yeah, and the compounding, one of the reasons, if you're not on systemic estrogen and you don't need that 100 milligrams, you can start with 50 milligrams of progesterone and see how that feels. And again, if you're not having all the symptoms of perimenopause, but you're having some that progesterone would be helpful with, 50 milligrams could be enough. Potential side effects of progesterone, sometimes people feel constipated and bloated, and so having the ability to do a 50 milligram tablet is great, and so that would be a reason why you might want to do compounding.
Additionally, if you are having those side effects, having a sustained release form, which would just be available at a compounding pharmacy, might help with those side effects.
Correct. But if those things are not a concern, the commercial pharmacies will have progesterone 100 milligrams or 200 milligrams, and you need to, like Martina said, 100 milligrams for the month while you're on the estrogen, or if you're doing a 200 milligram progesterone, it's just like 14 days of it.
Minimum. So you also could think about having a progesterone impregnated IUD, like the Mirena. That would also serve the purpose of protecting your endometrium.
Yeah, and a lot of people like having a IUD in the perimenopause period because usually periods are much lighter or you don't have periods at all. Yeah. And great form of birth control.
Yes. Should we talk about testosterone?
Yeah, let's do it.
Okay. Well, I like to think of them as like different levels of treatment. The lightest level of treatment, like the dipping your toes in the water, as Dr. Brie says, would be the cream or gel.
Yeah. And there's a couple of ways to get them. So testosterone gel is available commercially. Never ever is it covered, at least right now, for women. And so we cannot do a prior auth and get it covered. We can't, plead your case and get it covered.
That is because the FDA does not approve its use in women for this purpose.
Correct. We probably should have had this
Yeah.
disclaimer on there. But the commercially available testosterone gel comes in these tubes. You get a box of 30. For men, you use a full usually the starting dose is you use a full tube every day. You want to rub it on thin areas of your skin, inside of your forearm, inner thigh. Men usually do it up on their shoulders. For women, the dosing of the commercially available one is a tenth of the tube. So sometimes people find that cumbersome. Like, how do I know what a tenth of the tube is? Sometimes we suggest pea size, but like, how big is a pea? It's a little bit difficult to navigate, but certainly, an option if people want to go through the commercial pharmacy. The alternative is to do a compound of testosterone cream, and these have much easier ways to dose it. And so we're looking at one of the types. I believe this one is for women.
This one's for men. This one's for
men.
One's for men.
Actually,
okay. We can show you the women. It's going to vary, per
based on where you
pharmacy. Go. Let's see. How's this one open? Oops. Oh. So this one, it'll have on the instruction how many clicks you're going to need. So if it's 1, 2, or 3 clicks, and with each click, a certain amount will come out of the top. You can kind of see there.
Do you want to?
Yeah. So that's 3 clicks, and I'm just going to show you. It's a very, very tiny amount right there. So if you have any kind of skin allergies, or like you can't have perfumes or anything like that, that would be something to make sure that the compounding pharmacy is aware of.
Yeah, that's the cool thing about compounded pharmacies. They can kind of adjust their formulas based on your specific needs. And this is essentially like the click I showed before for the vaginal estrogen. You just click, and then apply. What are some other options for testosterone? So if people want to dip their toe, try the cream, it's not really working. My testosterone levels are not where I want them to be at. I'm not feeling any improvement. There are a couple of other options. Troches are one of them. And these it almost looks like a little square of wax almost. Mm-hmm. And you kind of put it into your cheek or your gum line, and it dissolves over 20 minutes. These typically will get people's levels up a little bit higher than the creams, and those are compounded only. Those are not commercially available.
And then, so that's a daily medication, as is applying the cream. Another daily option would be the BLA tablet, similar to what we mentioned for the estrogen. You can have them formulated at a compounding pharmacy, again, with a special coating on them so that they're able to bypass the first pass or the liver part of the metabolism. The troches are it's absorbed through the vasculature of your mucosa. There's all these little tiny blood vessels, and so that testosterone is absorbed into your bloodstream. But when you're taking the tablet and it's an oral route, there's that consideration. So the coating helps it bypass that.
Yeah. And then there are injections available. Testosterone injections, and so you're getting a vial of testosterone with syringes, and you're drawing it up and injecting a couple of times a week typically, and again, sometimes that's more absorbable for people, and sometimes people have more side effects or their testosterone gets too high, and then I would say like the dosing on that's also a little bit difficult because it is. The vials are coming at a concentration that are meant for male dosing, and so it's like a tiny little drop in the syringe. So that can be a little challenging. Yeah, I'd say we don't really, for women, we don't really do injection. For men, for sure. And for men, we forgot to talk about, there is a oral pill that's available commercially. called Kysotrex. And it bypasses the metabolism, so it's safe to use, comes in pill form, and I think there's 1 or 2 pharmacies that have it, so we have to special order it, but there are a lot of people that like that option as well.
For all of these options, they're short acting, and one of the problems with that is that you're going to have the short half-life, so the levels kind of peak and then trough, and so that pattern is associated with certain side effects. So just keeping that in mind, we may recommend one form over another. One reason to recommend Kysotrex is if, for example, you already have polycythemia or high hematocrit. This one is associated with fewer side effects in that way. So testosterone might increase your hematocrit or make your blood thicker. And if you already have a tendency for that, then that's something that's a really important consideration where, for example, Kysotrex doesn't have as much of a side effect
that's right.
problem with that.
Yeah. And then finally the pellets, which we've gotten excited about in the last several months because we started to offer testosterone pellets and estrogen pellets, and people have really good results with them. I think the biggest thing, like Martina said, because you have more of that steady state, you're not like in this pattern, you're just, sustained testosterone for women 3 to 4 months, and for men it'll last 5 to 6 months. And so those are, it's a procedure. You come into the office, we get you nice and numb. For men, it's going into the flank area, and for women into the glute area, into the subcutaneous fat layer. So you get nice and numb, we make a tiny little incision, and then we insert the pellets. And we don't have an example of them, unfortunately, but they're teeny tiny.
I usually describe, like, imagine a piece of raw spaghetti, and that's the width of these pellets, and at the smallest they could be about as long as they are wide, so like a tiny little ball, if you will. At the longest, I'd say probably like the length of my pinky nail or something. They're short. So you really shouldn't feel them after. I feel like it's a very quick recovery. Might be a little sore for a day or two, but it's a pretty easy procedure.
And they slowly dissolve over time, and we can again adjust doses, after when the 3 to 4 months are up for women, or 5 to 6 months for men, based on how you responded, how you reacted, and what your levels are at.
Typically, we check your blood work after the first time you get pellets. We'll check you at like 4 weeks after, just to kind of see how your body responded, because it's pretty amazing. Everybody is so unique. You could have a very robust response, or maybe not as much as we expected. And so if it's not what we had expected and kind of meh, then we offer a booster pellet at that follow-up visit. But that's just after the first pelleting that we do it that way. A lot of times we're starting with a pretty empty cup, and one thing that's important to think about in the dosing of the pellets is that initially you might need a higher dose, and the doses sound pretty scary high because think about it, it's being released slowly over many months. But as we fill your cup with each pelleting, you're starting at a higher level each time. And so by the 3rd or 4th pelleting, sometimes you might start having some side effects, which could be maybe some mild hair loss, maybe some acne. This would be something that we would really need to pay attention to, especially looking at the labs. If we're seeing that they're a little higher than what we would want, then we're going to recommend adjusting that dose down.
So you might be wondering at the end of all that information, well, how do I get started? How do I find out if I need hormones, and what do I do? And this talk is not about, all the ins and outs of the testing that's available. We just want to say, like, there are options for getting started, and at Direct Osteopathic Primary Care, that's our Healthy Hormone Program. And we can talk to you about, is blood work plus your symptoms the way to go? Do you want to take an even deeper dive and involve saliva testing and urine testing to look at, like, what are your storages of hormones and how do you detoxify them? And that's something that we're all trained in, that we can help you navigate. So yeah,
you can take a look on the website under our personalized assessments. Usually under the maintenance program, we're going to see you initially on a quarterly basis. And that's to check in and see, like, are your symptoms getting better? Are you having any side effects? What do your labs look like? Do we need to adjust your dose? But after a while, I think it gets pretty dialed in, and we can move to like twice a year.
Yep.
And some people are just once a year at their annual wellness visit checking in. Yeah.
All right.
So, thanks for tuning in. And if you have any questions, please don't hesitate to reach out to us in the portal.
Bye.
Bye.